we widen shoulders by lengthening of the clavicle. We're actually making your clavicle or collarbone longer. So the clavicle goes from your shoulder with a acromion to your sternum. And there's a joint here and a joint here. And we make a oblique cut in the middle. We distract the bones and then put hardware to hold it in that position. We use a hardening type of bone paste that turns into bone to thicken the bone, which turns into bone over time, in order to make sure the bone is not very thin, so it maintains its strength. Now, when we do that, it pushes your shoulder outwards, but it also pushes it backwards a little bit because your shoulder is actually a triangle. The clavicle is one length of the triangle. Your neck from front to back is the other limb, and the final limb is essentially your scapula or shoulder blade. Now, the shoulder blade is not a fixed point, a fixed distance. It is a pseudo joint, meaning it doesn't have an actual like arthrosis. It doesn't have cartilage on cartilage. It is a bone with muscle between that glides over your ribs. So it's highly mobile. Because of that, when we lengthen clavicles, the shoulder blade can slide outwards. Not only does it slide outwards, it can come up off the ribs slightly, which changes the way it slides a little. However, this happens a lot with just normal movement of the shoulder, so this is not really an issue. I've never had a patient complain of shoulder blade or back pain after lengthening of the collarbones. Over time as well, the muscles can stretch and you can actually get more widening of the shoulders because the posterior relocation of the shoulder can be altered with stretching because that shoulder can now come forward because again, what holds your scapula in place are muscles and those can be stretched out. Clavicle lengthening does not seem to have any issues with range of motion and normal activity can be resumed after full healing.